Welcome to our Women's Health event. We are so excited for this. We have been gearing up, and this topic is just one that's so near and dear to all of our hearts and so important, right? How gut health affects everything to do with our hormones, our weight connection, our health, our energy, really that enables us to be the women we want to be, right? So our goal tonight is to really empower you with information, with stories, with inspiration, whether you are just getting started on your plexus journey or you're considering it, or you've been with us for a while and you want to hear where you're going to go in the future from these beautiful ladies and their stories. We're so excited to bring this tonight. So a big disclaimer to kick this off is we are not claiming to cure, treat, or prevent any diseases. We are all with Plexus, a natural supplement line, and going to share our experiences, but we're not claiming any disease claims or anything like that. Even though tonight we do have an amazing, beloved doctor, Dr. Stephanie McCulloch, which is a dear friend of ours. I met her about a year ago, and she's such an incredible woman. She's going to share more of her background with you, but she's an OBGYN and has been for 20 years now and has really blessed so many of us with her knowledge, and we're excited to be able to give that to you tonight as well with these amazing stories. So with that, Dr. Stephanie, can I turn it over to you, and can you kind of lead us into, give us that overview of what is that gut health and hormone connection that we're looking at?
Yes, I'd be happy to do that. And Amber, I'm so grateful to be on this event too, because this is something that affects so many women in different walks of life, throughout their entire life. And it's just wonderful to be able to cast some light on this and to do it in a way that works with our bodies from a root cause approach. So I'm loving this big time. But a few things just to start out, as I'm sure we have people coming from, all different knowledge bases. So I'm trying, this is a big talk. So we're trying to, not go overboard, but provide the basics of information. So to start with, I just want to bring to everybody's attention that there are 7 crucial hormones in the body. Insulin, we talk a lot about insulin and that being the master hormone, and for sure it has its hand in everything, including hormones. Estrogen, leptin, cortisol, another biggie. Most of us are familiar with these. Thyroid, testosterone, and growth hormone as well. And so what we find is that our gastrointestinal health actually has direct impact on the proper functioning of all of these hormones. And that trickles out into, how we feel on a day-to-day basis, how our, reproductive symptoms are functioning. Do we have pain? Do we have energy? All of those things. So I like to use this little graph. Everyone's probably seen me hold this up like millions of times, but it's just so wonderful to really bring to attention how our GI tract affects our entire body. And then also that, our gut is so responsible for digestion and absorption, elimination and detoxification, microbial balance, and barrier function. So we're going to focus on those things and how those relate to our hormones, but I decided to do it with the help of the group in a way that I will, discuss kind of what a presenting problem looks like, and then what can be done about it. And then we will enjoy wonderful stories of health and improvement and success to go along with each kind of scenario. So one common scenario in my practice is, someone who's presenting and maybe in their 40s or so, and they are tired all the time, they are gaining weight and they don't know why. They cannot sleep, the libido is down, they just don't quite feel themselves, and they can't figure out what's going on. And it is crucial to bring it back to not looking at, chasing down insomnia, chasing down weight gain, but, seeing this presenting issue more as a tree. And we're looking for what are the root causes going on here. And, we're not going to, oh, this is the bat phone. I'll turn that off. We're not going to be going after each individual leaf, right? So blood sugar control is at the heart of this. And as we start to lose that control, our insulin levels can become abnormal. And as a direct effect of that, our cortisol levels, our leptin levels are also not going to be where we want them to be. To make matters worse, mental and emotional stress can be a direct contributor to leaky gut. So here we have some of the hormones that are prominent in the gut, creating havoc. And then we have our physical barrier breaking down. So, the lumen of the gut is one cell layer thick. So the separation between what's inside the tube or the lumen of our gut and what goes into our bloodstream, only one cell layer thick. And you can see where this is kind of a setup for some damage and repercussions as a result of that. So this mental and emotional stress, lots of women in this age range are facing, busy lives with work and kids and school, and maybe parents that are getting older, and we always think we need to do more and more and more. And this is, a direct physical effect that can ensue as a result. So the other thing that's huge is insomnia, and our sleep cycles can be disrupted. And this is just going to make blood sugar imbalance worse, make ability to lose weight more challenging. And it's also going to, have an adverse effect on our immune systems. So this furthers the problem. And then we have inflammatory burden. And again, when there's leaky gut going on, when you're not sleeping and you don't have time for that immune system to repair, all of these things are going to create more inflammation. And so many of us now, we think, gosh, why everybody seems to have a food allergy now, which really in some cases is true, but in other cases, this is more sensitivity to food particles that are seeping through the gaps in the cells and gaining direct access to our bloodstream and setting up inflammation. So this can show up in many different ways. It can show up in the skin. It can show up as, headaches. It can show up as menstrual disorders and body pain as well. So I really loved Julie's story. And I think, it really exemplifies a lot of this common, combination of symptoms, which in conventional medicine, we may be a little tempted to, go for a migraine treatment, go for a weight loss something, go for a sleeping medicine. And I'm so glad that that's not what happened to Julie. And I'd love to hear your story now, Julie.
Yes, thank you so much. It's so funny when you're talking, I'm thinking to myself, wow, that is totally me. So for me, my story is like many, right, who hit their 40s. Things start changing both inside as well as outside. I am a pastor's wife and a mom of 6 kids. I have 3 biological children and 3 that we fostered and adopted. My youngest is 7. So stress, busy ministry mom life, and age started to manifest in my health. 5 years ago, I was that girl who was always exhausted. I needed a daily nap. I would not be able to have the energy to play with my kids or my little one. I craved sweets. I drank lots of caffeine to get me through the day because I wasn't sleeping. I would wake up at 3 a.m. and I would lie there for 2 hours trying to get back to sleep. It was horrible. I was also having daily head and tummy discomfort. I gained 30 pounds in 6 months, no lie. And my diet and my activity were exactly the same. I was also really moody. to where my family was walking on eggshells because they were not sure what mom was going to be like that day. And every day I just woke up not feeling good, not feeling right. So I tried a few things, starting with eating a high protein, low carb diet. Basically, I was starving myself. And yes, I did lose weight, but the minute I started eating normal again, I gained it all back and even more. I spent lots of money on over-the-counter vitamins and other natural remedies. I even went to my OBGYN for help, and he told me that nothing was wrong. My blood work came back perfect. I was the epitome of health. And what he recommended to me was a glass of wine to help with my moods. I'm like, okay, fine, I'll do that. Okay. So all these changes that I was trying to make, nothing was helping because I was still struggling with all those same issues. And so in March of 2015, my friend, I was sharing with her, and she told me about Plexus. And I was at that point where I thought, why not? I am at my wit's end, and I am ready to try anything to feel better without prescription meds. And I didn't know at the time, but now I do. And as you're going to hear tonight, my hormones were out of whack. They were not balanced. And that is what was causing all of my issues, as well as my unhealthy gut. And so today, I am so thankful for my friend sharing Plexus. I no longer struggle with any of those previous things. I am in full on menopause, but I am sleeping soundly. I have all day energy. I have no more head discomfort or gut health issues. I lost those 30 pounds that I had gained, and I am maintaining through menopause. Those nasty sugar and all day caffeine cravings are gone. And I don't have any of those daily hot flashes. I should be miserable right now, but I am not. I am a totally different person, and I am so thankful. I feel better now at 53 than I did at 33 with all my littles. So it's amazing. Thank you for letting me share that.
Of course, that is amazing. I'm so glad to hear it. And I think, product wise, I recommend a lot of the triplex because it's getting to, that core system approach all in one. And, with Slim, our pink drink, we do address supporting the microbiome. We do reduce inflammation with that, and we stabilize blood sugar. So, what a single hitter. That is just awesome to have that. And then combining with the BioCleanse and the ProBio 5 to ensure proper elimination, further breakdown of candida or toxins, and enhancing nutrient absorption. That is going to go a long way to get someone on the right path. So along those lines too, I've been recommending active a little bit more for the energy, because it is a clean energy, non-jittery energy, and it's combined with a powerful antioxidant blend, that S7 blend. So I find that to be a really big help as well, especially transitioning off of energy drinks or, lots of caffeine, things like that. So thank you. Yeah. And then, the other situation that presents quite often are women having really heavy, painful periods, and maybe they haven't quite been diagnosed with endometriosis yet, but endometriosis is one of those diseases that is likely really underdiagnosed and under-recognized in our community. But even, if it's not to that severe extreme, a wonderful approach is to, again, look at those 3 R's of gut health with, remove, restore, and replenish. And the science behind that is really, fascinating, in that our hormones are, floating around in our body. And I'll show you this nice diagram now, but it's all the breakdown of hormones, and that needs to happen in order for our bodies to, clear the waste and the hormones that have been used up, so to speak. And if that doesn't happen properly, then those hormones that are unhealthy now, a lot of times an unhealthy metabolite, can then recirculate back into the system and start to sit on the receptor of the cell and cause problems. So we need our livers functioning optimally, because our livers basically take these fat soluble hormones through phase 1 and phase 2 metabolism and convert it into a water soluble hormone, which then can be readily excreted, with bowel movements or with urination, no problem. Another key thing to realize is that many of the enzymes that we need to make this process go through the liver are created by our good gut bugs and by our microbiome. So it's hugely important to, to have the healthy gut bugs, to have low inflammation at your gut, so that we can make these proper things that we need to get the job done with our hormones. Another important part too to this process of phase 1 and phase 2 detoxification in the liver is that it uses a lot of the B vitamins. It uses amino acids and things like that. So in our typical diet, even if we're trying to eat healthy, our food is just nutrient depleted. It's not as nutrient rich. The soil is not as good as it once was. So this can be a challenge, and that even though we're eating healthy, we're not really getting all those nutrients, or perhaps we have leaky gut. There's a biofilm buildup in our gut, and we're not absorbing the nutrients that we're trying to put in. And so I really like to, of course, even with someone who is coming in with just miserable, bad periods, cramping, the whole thing, conventional care is things like a birth control pill. But isn't it wonderful now to be able to say, hey, let's support your gut a little bit. Let's try the triplex. Let's add our fully methylated multivitamin X Factor or X Factor Plus to give your liver that support it needs. And, even if you're not a great vitamin taker, the lean shakes are fully, supported with over 23, 22 different minerals and vitamins, all in the methylated form as well. So I think that's a wonderful way to go for people who are maybe a little more adverse to taking lots of capsules in a day or busy on the go. It's great to, be able to get covered in a couple different ways. And then the other thing relating back to this problem of not metabolizing our estrogens properly, well, excess estrogens have an increased effect on prostaglandins in the body. And prostaglandins are these kind of molecules of inflammation, and they are behind a lot of what causes a lot of the cramping and more pain with periods. So, again, throughout this talk too, we're not claiming to cure disease or, diagnose disease just through using these products. But I have really become in love with the product called Ease, because with its, ingredients, it does an excellent job at calming those inflammatory pathways. And so, Ease has an omega from the green lip mussel from New Zealand. And the key extract there is something called lipronol. And lipronol is known to block inflammation at its base. So it's going to block that arachidonic acid pathway, which then goes up to one side leukotriene, the other side cytokine, prostaglandin side. So it's going to block both. So, when people give testimony saying my pain was less, my cramping was less, even my allergies were less, and you're thinking, what is going on here? That's kind of what's going on. And then the turmeric that's in the Ease and the bromelain, further anti-inflammatory, is just a really wonderful combination. So remove is super key. Restoring with something like the pink drink, Super, super key to let that gut heal. We have shown that Akkermansia and other healthy gut bugs increase 200 to 300 times with Slim. And when that happens, it has a very healing effect on the gut lining. So that's wonderful. And then replenishing, with something like Vital Biome, which is the full spectrum probiotic, and as well as the X Factor multivitamin. And another thing about Vital Biome, a lot of women have really bad PMS as well. And sometimes I think they just get clumped in and, in the birth control group pack, or sometimes even in an antidepressant. But there really is no strong clinical data showing that the birth control pill helps with mood symptoms. And in fact, I'm sure most of us have had experience here where it can actually make it worse. But using something like Vital Biome, the first 2 strains included in there are listed as psychobiotics, meaning that they help with our psyche, they help with stress and anxiety and mood. And then it also has immunobiotics in it as well, which are strains of good bugs that have been shown to bolster our immune systems. So, Courtney, I think that your story is really excellent for this situation. And can you tell us about it?
Hey, lady. Yes, I love all your knowledge. Seriously, you are amazing. So I'm so thankful you're explaining this, because honestly, I started Plexus not knowing a thing about gut health. I thought my sister was a little bit crazy when she said I had leaky gut. And I was raised pretty holistic. My mom had me at home on purpose. And I still remember as a kid, we ate from the health food store. We didn't do food coloring, any of that stuff. And yet somehow I still had leaky gut. Just like you were explaining, the soil depletion, all the things. So my first period, I still remember we were eating dinner and I went to my room because I felt so sick to my stomach and I started just throwing up and I felt so crampy and so miserable. And I ended up starting my period. And I thought that was just normal. You guys, this was like literally my whole childhood. I didn't throw up every single time, but a lot of times the cramps were so severe that I would be, for a couple of days and then it would slowly go away. So for me, my whole childhood, whole teenage years, even young adult life, I thought this was just being a girl. I thought I was craving sugar and just had a crappy period because it was just my life. And it was normal. So I started Plexus and I did not realize it was going to help with that at all. I thought that I was just going to lose a couple of pounds of baby weight that I wanted to get rid of. And I was like, well, if my sister's taking this, I should do it too. Why not? So she had me write a list of all the issues I had beforehand. And I also had an ovarian growth, I will say, for lack of a better word, that the doctor was trying to fix with birth control, but Fallon was like, oh, no, you're going to get on Plexus. It's going to help everything. So that went away. The terrible periods went away. I was no longer sick in bed and after I have kids, it's kind of hard when you have a life to just be sick in bed with a period every single month. So I was super thankful to see that as a symptom, along with a million others almost, go away just by taking supplements to balance things out. And I'm forever grateful that Lori shared with Fallon and Fallon insisted that I try this and help myself out here.
That's wonderful. Thank you so much for sharing. And God, what a game changer. I mean, we have our periods for 30, 40 years of our lives, and that I just see this time and time again. Women are really willing to suffer so much and they don't need to. They really don't need to. And it's healthier for them if they're getting their gut under control and supporting that. And then the improvement in the hormone symptoms is kind of just a happy side effect, really. But yeah, so the next case I wanted to bring up, something that we see quite often, is polycystic ovarian disease or polycystic ovarian syndrome. And anytime something is called a syndrome, it usually means we don't have totally clear parameters by which to define it. but people are meeting enough of the criteria that, yeah, you go in this group. And it does affect, probably 5 to 10% of women in the general population that we know of, that are coming in and getting help. Some people are just kind of being miserable. So interesting to me, as I started to, learn more about gut health and integrative care, the causes behind PCOS include dysbiosis, which is that unhealthy shift of good to bad gut bacteria. And then also insulin resistance, which we talked about earlier in the beginning of the call. As things, as blood sugar is not balanced, our pancreas tries to create more and more insulin to bring balance back. And then your body, in a sense, is just bombarded with too much insulin. Those receptors are saturated and it's ineffective. But our systems are just wired in that way where when we're not getting the result that we need in the cell, our brain just says, make more of that. So insulin resistance is huge behind polycystic ovarian syndrome. And then something else that happens is that sex hormone binding globulin decreases. And this makes the situation even worse because this binding globulin is something that binds to testosterone so that we don't have too much testosterone floating free in our system. It's healthy for us to, as women, we have estrogen and progesterone predominantly, but we also have some testosterone. But this situation leaves, too much floating around, which can lead to further problems of acne and hair loss, which honestly is why a lot of women present, because they start to see these, their periods are going away, they're growing hair where they know they shouldn't be growing hair. But as a doc, I'm concerned more about what is going on with them metabolically for sure, because this situation in time can lead to a higher risk of diabetes, can lead to a higher risk of cardiovascular disease. It's often associated with being overweight and then, all the sequelae that come with that. And so when we're making recommendations, yes, exercise for sure. And just to back up a little bit too, like anything you can do to reduce stress is going to help with whatever problem you're having, medical problem, psychological problem, anything. So we always like to, start with sex. It's not sex, but with addressing your exercise, addressing your stress. Maybe that could be a way, right? And then also good nutrition. But specifically, some items that help are chromium, are things like cinnamon, vitamin C. And so again, think about the triplex for core root support to get a hold of that insulin imbalance. Not trying to make too strong of a claim, but we are seeing it. We are seeing Slim improve, blood sugar levels on labs. We are seeing patients with gestational diabetes who are having, positive improvements in their blood sugar levels. So that's, it's a wonderful thing. It's a little anecdotal at this point, but definitely worth sharing. So things like your X Factor Plus, where you're going to have your plenty of chromium, you're going to have plenty of vitamin C. And then products like Balance with its cinnamon and kidney bean extract, that's going to help slow the absorption of carbohydrates over your bowel wall and help out, insulin stabilization that way. So I really, love these products for this condition as well. And I'd like to hear from Crystal now, and she can share with us a little bit of
thank you so much for having me tonight. My story begins way back when I first started my periods. And it became a normalcy for me, right? Like, we know so many women struggle with this, that it just becomes like this blanket of normalcy, and we don't reach out, and we think extreme discomfort is normal, and really heavy periods are normal, and crazy mood swings are normal, and all those things. And so oftentimes it would get so bad that I would vomit. I would have to miss lots of high school. It even continued into university. And so it really put a damper on things. And I mean, even into my adult life, it just continued on because I had no other way. Doctors put me on birth control, like Dr. Stephanie had said is the typical treatment. And that helped bring down the cramps and help my cycles become regular. But I really didn't like that idea of trying to take over a function that my body was designed to perform on its own. And so my cycles were anywhere from 40 to 60 days long. And so you can imagine when we were trying to get pregnant, it was quite difficult with both of our children. We have 2 beautiful children now, but it was quite the process. So ultrasounds would show that I had irregularities with my ovaries, and that's what was causing my symptoms. But like the doctors couldn't help me. And so I just kept taking Midol and Advil and kind of suffered through it and missed work and missed school when I had to. And it wasn't until my best friend actually recommended Plexus to me for other reasons. I actually started on it for my bowels and other reasons. And I didn't actually think that it would help with my periods because I hadn't really been educated how the connection works. But it wasn't until about 3 or 4 months into taking Plexus that I had noticed that these discomforts and the mood swings were kind of disappearing slowly. And now I don't experience any of that. My cycles are 29 days, like it's down to clockwork. It's awesome. I'm not on birth control anymore, obviously, but yeah. And so no more premenstrual symptoms, loving life, feeling healthy. I lost 45 pounds. Yeah.
That's wonderful.
And,
Yes.
just so blessed to be where I am now.
Yeah, that is great. Really great. You know, the other thing as you were speaking that came to my mind too is so many of us are, needing to rely on NSAIDs, Tylenol, the Aleve, these things for pain. And sometimes you really do need it, but long-term, it's not a great long-term game plan, right? Because this just wreaks further havoc on our guts. It further destroys the microbiome. It further leads us into dysbiosis and also further leads us into leaky gut and intestinal permeability. So it's just kind of becomes a vicious cycle. And then the same with the birth control pills, they do have their place for sure, but they are depleting of some of our micronutrients as well, especially vitamin B12. And when you look at studies on, depression and anxiety, many times a B12 deficiency is what's behind that. So it's like, how much of the problem are we kind of creating in trying to, treat these symptoms? So I think it's just important to keep those things in mind too. And not to mention the fact that having the discussion with a woman who doesn't want birth control, that she should be on the birth control pill, is never fun. Like no one ever wants to do that. So yeah. And so now we have a more root-based approach. Okay. So the next area that comes into the realm of female hormone problems and GYN even is thyroid issues. And when I went to medical school, thyroid was a different department. It was endocrinology, which is kind of a joke because it's really closely related to our cortisol levels and our other female hormones as well. And so in practice, it's more of this, what we call the Charlie's Angels of hormones approach, meaning that thyroid, your female sex hormones, and your cortisol are all very much related and dependent on one another. So that is a much better approach to take, and I think it just helps make things make a lot more sense. And then when you back it up a step further to what's going on in the gut, specifically with any leaky gut and whatnot, then, you're not making the correct hormones that you need for proper thyroid and hormone balancing. And then on the other side, you have the microbiome. And when you don't have those proper, gut bugs and whatnot, that is further devastating to nutrient absorption, to making proper vitamins that we need, like K and B12. And then also just inflammation in general, back to the leaky gut side, which now whenever I see thyroid, I'm thinking about leaky gut because, so for so long we were taught it just kind of happens. we called it essential hypothyroidism. We don't know really why. It just seems to kind of burn out in women over time. Pregnancy was always a risk factor, especially for the opposite, not low thyroid, but high thyroid with Hashimoto's. So it's really refreshing to be able to kind of backtrack a bit and follow that line of inflammation back to the gut, to have control over, changing things dietary wise, eliminating gluten, working on stress, doing exercise, and then really supporting the gut in a healthy way. So Catherine has a really wonderful story to share regarding that. And are you there, Catherine?
I am. I'm hoping that we have a big rainstorm here in Minnesota tonight, so I'm hoping that my internet sticks with us. So similar to a lot of people on here, my whole life I had struggled with some gut health, one extreme or another. And as a young teen, I also experienced a lot of heavy cramping, days missed at school, on the floor in a lot of discomfort, right? That's a light word for what it was, right? And I was given those huge cow pills. They were like a really heavy dose of ibuprofen to deal with it. And then over time, they did put me on birth control as well. And, that dealt with things somewhat. And then when I was 30 when I got married, and I had 3 kids in 5 years. In between my second and my third child, I also had a large mass in my pelvis. It did not attach to my female parts, but it attached to my colon, and I had to have that removed as well. And then found out I was actually pregnant during that surgery with my third, and we didn't know it, which was a little like, oh my gosh, right? But then after I had that child, my body crashed. Same thing as what you've heard from other people. I gained 30 pounds in 2 months while breastfeeding. I knew that something was not normal. Went to the doctors multiple times. They're like, could not figure out what was going on with me. I was in a lot of discomfort. My joints, I couldn't even carry my kids upstairs. I was taking multiple naps a day. I'm a college professor, and so I know how to research. And I was researching all about this different things, what I could do and everything like that. Finally, at 8 months, my doctors did diagnose me with an issue with one of the glands that she had talked about. So I can say it, thyroid. So diagnosed me with an issue with my thyroid. And they gave me a little pill and said, hey, everything's going to be better now, which I'm like, awesome. It was a cheap pill. I thought everything was fine. I didn't know enough, right? But it wasn't fine. I was still very tired. I still had a lot of discomfort. I could not function on a daily basis. I would take naps in between my office hour, like in my office hours between classes, and just like severe mood swings, like not a happy mom, right? This was not how I dreamed of having babies, right? It was just surviving. It was really sad. And I was depressed because of it, right? I just felt like I was failing in so many ways. And then I was researching, trying to get myself better. And my doctors just kept on saying, just take your pill, right? And I'm like, but I'm having all these crazy things happening with my body. And they had no answers for why. They're like, according to my numbers, I should be feeling good, right? And so I was reading about gut health. I was reading about blood sugar imbalance and basically, I feel like God just dropped plexus in my lap at that point, and it all came together. I'm like, this is everything I'm looking for. But of course, I still wasn't quite sure. Like, does it really work that way? And one of the things that were happening during that crazy time was my cycles were all over the place for 3 years after my son was born. Like, I just didn't know when it was going to come. It was awful, like very unpredictable. And one of the ways that I knew that plexus worked was in month 2, when my cycle regulated for the first time in 3 years, right? And it's been like clockwork ever since. And I had a lot of vitamin deficiencies and everything like that. So plexus, after plexus, my gut health was better. My vitamin deficiencies, we literally could watch them come up, which was just awesome. My stomach problems were going away. My hair stopped falling out in chunks. And I had energy. Like, one time I ran up the stairs and my husband's like, "Did you just run up the stairs?" And I'm like, "I did." And he's like, "You're never going off of these." I'm like, "I know." Right. So, and then that little gland has been also, with working with my doctors, has been functioning, at a much better level, which has been really awesome. So, thanks to plexus, I no longer deal with all those crazy hormones, all those like way crazy symptoms in my body. And my emotions and my hormones no longer govern my life. So I'm really thankful for that.
There you go.
Am I on?
Yes.
Okay, sorry. My camera just kind of went away. Thank you for that. Okay. So the other issue that I see a lot in the practice too is women coming in with just uncontrollable weight gain. And I have to say, in my younger years, in my residency, in the back of my head, I'm thinking you need to eat less. But after nearly 20 years in practice, and you're hearing the same thing day in and day out, it's like, maybe there's something more to this. Maybe there's something more going on. And oftentimes that is the case where, women are really trying hard to eat healthy. They're trying to drink their water. They're exercising like crazy. And it's just not budging for them. And a lot of what is happening, and this goes back to, again, is the story with insulin. And once we become insulin resistant, that can lead to a condition called leptin resistance. And leptin is a hormone that it's made by our fat cells, and it is there to signal to us that when we're full, and so that we have a healthy appetite system working for us to give our bodies the signals of, when we're hungry. Leptin specifically tells us when we're full. And when this is not working properly, again, I said earlier in the call, the brain doesn't know that, it's an issue with the gut. It just thinks, there must not be enough leptin getting to the receptor. So we're making more leptin, which just makes the problem all the worse as far as furthering the insulin resistance, and then also leading us to cortisol imbalances as well. And then another feature I see quite a bit is, in our desperate attempts to lose that weight, you're exercising more and more. I had a patient once, she was exercising, full on aerobics for an hour, playing tennis 2 hours a day, and she just couldn't figure out why she was exhausted and couldn't lose weight. And, when you're jacking your cortisol levels up high like that, that further adds to the insulin resistance. And when we have too much insulin, one of the things it does is it triggers our bodies to store fat, particularly around the hips, thighs, and waist area. So, leptin is definitely a gatekeeper of fat. It contributes to low-grade inflammation as well. So getting around it is balancing blood sugar and reducing your inflammation. So again, you can see how well a system like Triplex fits in here. And so Lori, I'd love to hear your story and hear about your success.
Yes. And I just want to say again, like, we're not claiming to cure or prevent any disease. And so when disease names are mentioned, they are mentioned loosely, like we're not, and blood sugar, glucose metabolism is a word that I prefer to use. But I think that for me, I don't know what was going on with me. When she started talking about crazy weight gain, I was like, I'm next. I know that. This is going to be my story.
Even if you fell asleep, you knew it was you.
I knew where I was going to be. And okay, so to back up, I've always been into, so I'm Amber's mom, okay? And I have 4 kids, I have 7 grandkids. I found myself at a later age, like my late 40s, where my body was completely not cooperating or functioning like it ever had before. I don't know what it is really about 3 o'clock in the morning, but that was me too. I was waking up at 3 o'clock in the morning, and I've always been into health and fitness. I've always been on the curvy side, but never overweight. And when Plexus found me, I was at a place where I had just come out of a crazy cycle and gotten help through naturopaths, and I'd done the whole like MRT test, metabolic response test, to detect which foods I wasn't supposed to eat. But I had been at a place where I was gaining almost a pound a day and doing all the dieting that I knew to do, doing all the exercising. And I had just got a handle on that to where I wasn't gaining the weight, but I could not lose it. And so I went out to visit my daughter, Amber, and she was taking Plexus, and I had, what she didn't know is I had just decided that I had some crazy thing going on in my body. This is just part of being older, part of being a grandma. I still loved to work out, but I was definitely slowing down. And I thought, I need to grow old gracefully. I need to accept this. If I've stopped the weight gain, at least I need to be at this place that I'm at. And she said, Mom, why don't you try this? You know, you've been complaining. So I had resolved to accept my place, but she was right. And so it changed everything for me. And I was one of those really healthy eaters. So why I was in this place in my life, I don't know. But I've lost 40 pounds and kept it off. In August, it will be 7 years. And I would not go a day without the products. Yeah. I also had a lot of digestive issues that I realized I'd been such a healthy eater because I'd had to baby it my whole entire life. And so I don't have those issues anymore. And I feel like I've literally aged backwards. And yeah, my body makes sense.
Thank you, Lori. You look like it too. That's awesome.
Thank you.
Oh, okay. So I alluded to it a little earlier, the issues with very painful periods, heavy periods and whatnot. It is a bit of a gray zone, but the maximum of that is considered endometriosis, and it affects more women than we necessarily know. And it also means they can start to have pain all month long. And they can have pain, not just pelvic pain, but it can be abdominal pain and other symptoms as well, because the nerves that innervate down there are shared with your bowel as well as your bladder and your reproductive organs. So endometriosis is a little poorly understood as far as what causes it. There are theories that maybe it's genetic, maybe there's retrograde menstruation through the fallopian tubes. But one thing of late is our understanding now of the role of intestinal permeability or leaky gut. You guys know it, and the cause of endometriosis, at least a contributing factor. Something else that's being looked at too is the role of systemic yeast overgrowth, and endometriosis as well. So when this happens, the cells that normally are just supposed to line the inside of the uterus, the endometrial cells, actually can take root outside of the uterus, like on top of the uterus, on the tubes, on the colon. And each month with the shifts in hormones, that can set up more estrogen symptoms, which, like I just spoke about earlier, include more prostaglandin production, which then can turn into a very painful situation for the person who's experiencing that. So, what do we do about endometriosis? Well, now we clean up leaky gut first and foremost. Yes, there are surgeries, there are hormone blocking medicines, but who wants that if you haven't even looked at your gut? Such a simple thing to do, we really don't want to miss this step. It's really important. Blood sugar balance is going to help reducing stress again. Things like, green tea have certain chemicals in them that inhibit some of the implants. So that's wonderful. And then, watching what's in your environment is really crucial too, because we are exposed with endometriosis. It tends to be estrogen that feeds those implants, and estrogen is kind of like fertilizer to them. And so we do have, peaks and troughs in our estrogen levels naturally, which is throughout our menstrual cycle through the month. That's normal. But in our environment, we are exposed a lot more now to chemicals that we call xenoestrogens, and they can wreak havoc in our body and act similar to estrogens in some ways. They can actually impede fertility, but they can, increase the symptoms associated with pain and endometriosis. So I'm sure, I'm probably speaking to the choir, but, things like plastics, BPAs, some items found in your cosmetics and skincare products can also harbor these chemicals, which over time, can build up in the body. And then you see, if you add that to a system that's not doing the 3 R's very well, that's not removing, that's not being, restored or replenished, then this can lead to a big problem. Our body's, the normal defenses it has to remove toxins are now, jeopardized. So, so that's pretty much what we have with endometriosis. I could go on the science, but I think you guys get the drift. And I would love to hear Justina's story about that.
There we go. Hey guys, I am so excited to be able to share my story with you guys tonight.
Yeah.
So mine starts back when I was 15. I got my period really late. I was excited to get it at that point because all my friends had it already and I wanted to be a woman too. But it was a shocker because it came in so different than I expected. It was far more uncomfortable and just, wow, yeah, intense. Like not what I had hoped, I guess. And that's kind of where the crazy cycle started for me. And then I didn't get it again the next month. So I was really shocked. I was like, what's happening? So I talked to my mom about it and we tried to troubleshoot. So from there on, that was my life. Every 3 to 10 months, I would get my period. I skipped a whole year once. We started seeing doctors. We went to a gynecologist trying to figure things out. And they were just getting more and more intense. Every time I did get it, it was so bad. I was on Tylenol between my cycles at this point, usually 7 a day. And then during my cycle, I was using 7 at once, 3 times a day, 10 days long each time. It was crazy. And it just kept getting worse by the years. So I got surgery done, opted for that because I was getting medical help, right? And so we went on birth control. My mom said, just try it, right? I didn't know better. That's what I'm going to say. I tried birth control. We tried the shots. And that was 10 years in. I knew I had to find a different way out of this. So we switched to diet, herbal concoctions, and it kind of got better. Like it wasn't, I was using hormone replacements and all such things. But what it helped me with though, which the doctor said I'd never have kids. So we had 3 kids back to back, which was a shocker to my doctors. And I was so happy because of course I wanted to be a mom. That was like my dream. But after baby number 3, my health just crashed. Like I was exhausted. I was in bed every other day. I couldn't even take care of my kids half the time. And so that was when my best friend came over one day with this little packet of Slim, and she's like, I think you should try this. And I figured, you know what? It has the word Slim on it, and I want to lose weight. And it just looked like fun, and it tasted so delicious. So how can it help with my issues? I couldn't see that. But I started reading testimonies, which got me excited, right? What if this could help? And it didn't help me lose weight. I was very disappointed. But I was thinking about all the Tylenol, and at that point I knew that my liver was just a wreck, right? From all the Tylenol I've been using. So I kept using it, hoping for results. And 10 months after I had started using it, I got my period back. That was after my baby was 3 months old when I started the pink drink. And I got my period back, and I didn't even notice it coming up. And before that, like I always knew weeks before that, in about 3 weeks, I'm going to get my period, right? And now suddenly just came upon me, and it was completely, I didn't even notice I was on it. It was short, like 7 days long instead of 10 days. It was so amazing, and I could hardly believe it was real, right? But then it happened again the next month. And then I started having a whole year of 28 to 30-day cycles, which just blew me away. Mm. And then we got pregnant with number 4, which really surprised us because we didn't think we'd get pregnant without, using hormone replacement. So yeah, like it completely, can I just say completely changed my life.
Yeah.
So we're very, very grateful. My husband is very grateful that I'm on the pink drink. And it's really been an amazing, life-changing experience for our family.
That is wonderful. And, I think something to bring up too is that when we have issues with insulin resistance or leptin resistance, things like that, our bodies actually need time to create new receptors because the receptors on the cells are full. They are maxed out already. And so it takes time for that downregulation to occur. And then the cell can generate new receptors that are now open and ready to be responsive to a new healthy, stream of hormone influx. So sticking with these programs, 3 to 6 months is a very important thing to do. And some people are fortunate, they get results, quickly, but others of us, it just takes some time. So, but it's worth it. So after our journey of all the pain problems and the period problems and all of these things, we then go in and encounter menopause. And that's another big thing. I see lots of women with menopausal symptoms in my practice. And we call it the vasomotor symptoms of menopause, but that's really just a big blanket for, hot flashes and night sweats and things like that. And, once again, we do say, oh, well, dress in layers, try not to eat too much sugar, avoid alcohol, and that's fine. But that, these symptoms can be extremely debilitating for many women. And so we do oftentimes, rely on hormone replacement therapy, which now has gotten better that we have bioidentical options. But it's really wonderful to know that there are very effective plant-based products that can severely diminish the intensity of hot flashes and night sweats too. And so I love to rely on the X Factor Plus for this. Because of the grapeseed extract in the product, we see an improvement in hot flashes and night sweats, but also there have been trials done, 8-week studies or so, where they've tracked women and not only seen a significant decrease in their hot flashes and night sweats, but also improvements in their blood pressure and an increase in their lean muscle mass. So we like that we are not only addressing the symptom, but we're really doing some good stuff for our body at a core root base level. So Metaburn's another product to consider during this time because it is, this time of hormonal fluctuation does lead to changes in insulin and changes in cortisol. And Metaburn has products in it, has plant-based products that really support our adrenal glands. They're known as adaptogens, so our body's able to use it as it needs it. And that can be a wonderful resource during this time as well. And Debbie's going to tell us all about her experience with that. Is she muted?
Hold on, you're muted, Debbie.
Can unmute.
Try it again. There you go.
There you go. Hi, everyone. Well, thank you so much for all that information. It's amazing. And I'm so grateful for you to get to work with you and for Plexus. It's just amazing stories and testimonies.
Yeah.
So before Plexus, for me, I had really extreme discomfort in my back and my neck. And I'm going to talk about my menopause, but I can't leave out the things that I went through before menopause with Plexus. I've been on it for about 3 years now. And I couldn't sit down with my family at dinner. I couldn't sit in the car. I went to all the specialists to try and get help. And they all just told me that there was nothing they could do for me. I had degenerative stuff in my low back. And I originally started for weight loss, which I did lose 43 inches in about 2 months, just being on the products. And on the past 3 years, I've just felt like I'm 20 years old and I have more energy than most people, including my 17-year-old daughter and all the people around me. And so recently I started, I think, going into menopause because I haven't had my period in 140 days. So I'm thinking that's probably menopause. And so I was talking to Dr. McCulloch's on our walk, and I said, I think I'm going to be the poster person for Plexus because I don't have any menopause symptoms. And the next day I started getting like hot flashes and my mood just went really low as soon as I said that. And so we were talking about my options and hormone replacement. She's like, it's just a matter of when you want to go on them, not if. It's just like when you're going to start them. And I was like, I don't want anything. Like I don't want to start them. I don't mind the flashes. They're okay. they're not too bad. And so I realized, because I love the chewable Kids X Factor, that I was taking those and not the regular X Factor. And so I started back on those and the MetaBurn. I just started 1 MetaBurn a day. And within 2 days, it's been about 3 weeks now, I haven't had one hot flash. My mood I only suffered with my mood for like 2 days, and I haven't had any down days since I started back. And I'm just so grateful that I don't have to take prescription anything after being on ibuprofen and painkillers for almost 2 years. I really just want to only put good things in my body, and I'm just so grateful that we have options. So yeah, and I really do feel like Lori and I walk all the time, and Steph, and I think we have more energy than most teenagers, which is kind of amazing.
Absolutely.
Being that we're like, I'm in menopause, so I'm just, yeah.
And I think one last thing too, thank you, Debbie. But one last thing I just want to comment on too is, what health and restoration and improvement in life has come from these women just sharing with one another, the simple act of sharing and not being afraid and not giving up. And so, things just weren't working. They were trying to seek the proper routes of care. But I think it's wonderful to be able to trust one another, to unite and to share and to get these awesome results. So that's very rewarding for me.
Yes, thank you so much, Dr. Stephanie. That was amazing. And ladies, for taking the time to share your story, be vulnerable and real with us. I don't remember who said it, but women suffering so much and it's not necessary. I heard that line in there, and I heard that truth in so many and all of your stories, and the comments were blowing up and people saying, yes, this was me. I wish I had had plexus a decade ago. I wouldn't have suffered so much. So thank you for sharing with us the connection between why we're noticing these great results and we're not having to suffer anymore, when so many of us just thought this is the way it's going to be forever, right? And we just kind of resigned ourselves to that. So thank you so much for giving us your knowledge and your time. And for everyone watching, we hope that we inspired you with these stories and information. I'm sure you were. I know everyone is taking something away. And just remember what's going on in your body and where you're going with this and what you have to look forward to with that consistency and time. Those 3 R's that you mentioned: removing, restoring, replenishing. And I love, we'll just end with the analogy of the tree that you brought out, that we don't look at the leaves as individuals. We go down to the root system, and we have the health of a tree by the root system. So thank you so much for pointing that out, Stephanie. Dr.
Absolutely.
Stephanie.
Thank you to all of you guys. It's just, it's incredible. Really refreshing to hear these stories, to know there's hope, to know there's a better way. It's wonderful.
Yes, and the testimony, people are commenting, blowing it up, saying yes, thank you to all of you. So, all right, have a wonderful night, and thank you, everyone.
Okay.
Bye.
Bye. Thank you.